For the American Council on Science and Health, I'm Anna Dolosky. This was way before my time, but there was a time when childhood diseases were alive and well, and some of you may remember. Days of missing school, high fevers, rashes, and chickenpox parties at night. And before the first measles vaccine was introduced in 1963, this was simply the norm. Luckily for us, today these diseases are preventable by vaccinating your children, so these crazy outbreaks can't and don't happen. Whew, right? Wrong. Just last year, there were several measles outbreaks across the nation, including California, New York, and most recently in Disneyland. Take a look at this chart from the CDC. The numbers don't lie. A tenfold increase in measles cases from 2012 to 2014. A clear sign that parents are not vaccinating children with the MMR vaccine. Exemptions for religious beliefs are only a small part of the issue, but the problem is part of a growing epidemic, the anti-vaccine movement, promoting philosophical exemptions and scare tactics. And here's how it got its legs. This is Andrew Wakefield, a British doctor who in 1998 was the leading author of a paper published in the highly prestigious British journal, The Lancet. The paper reported on 12 children diagnosed with autism, and the authors suggested a link between autism and the MMR vaccine. It didn't take long, though, for investigative journalist Brian Deer to discover that Wakefield's claims were fraudulent, driven by financial gain. So Wakefield was stripped of his license and the Lancet retracted the paper, but the damage had been done. Wakefield is very much a hero in the anti-vaccine community and touted by celebrities like RFK Jr., Jim Carrey, and Jenny McCarthy, who just happen to have a huge following and can easily persuade people that their celebrity status gives them a platform to speak on science, rather than actual scientists. Of course, the Wakefield saga opened the doors to other scares like toxins and vaccines. Robert F. Kennedy Jr. has long been on the bandwagon of the thimerosal scare. Kennedy has written books on the dangers of thimerosal, also known as mercury in vaccines. But his claims are also ludicrous. Thimerosal is a preservative, only added to vials of vaccine that contain more than one dose to prevent the growth of potentially harmful bacteria. The levels of mercury contained in vaccines are not harmful to human health. And of course, anti-vaxxers somehow fail to acknowledge the monumental value of vaccines to public health. For example, the flu vaccine saves millions of lives, especially infant lives, since babies cannot be vaccinated before 6 months of age. This is why mothers-to-be are urged to get the flu vaccine. Newborn babies who are too young to be vaccinated are 60% less likely to catch the flu if their moms are vaccinated. Other vaccines are also often underutilized, like the HPV vaccine that's very effective in protecting women against cervical cancer, or the meningitis vaccine, which protects against bacterial meningitis. So why the resistance? And with so many stringent rules and regulations, how are parents getting away with it? One loophole is that philosophical exemption that's still an option in 16 states. The good news, California recently became the third state to disallow both religious and philosophical exemptions for vaccinating children. In many of the 16 states with both medical and philosophical exemptions, legislation has been introduced to toughen the requirements. Even more good news is that the tide is turning. A recent University of Michigan survey has found that 35% of parents report more support for vaccine requirements, and that message has been echoed by other recent surveys as well. To read much more on vaccines, you can like our Facebook or visit our website, acsh.org. Don't forget, while you're there, you can also sign up for your daily dose of news delivered straight to your inbox. For Action News, I'm Anna Dolosky.